and something to pull the toxins out through the gut. So the interesting thing is, instead of taking 12 pills, this same company makes a product that helps the liver pull the toxins out, and bind pulls them out of the body. So it'd be this with some homeopathic. So instead of $1,000, it's about $200 a month, and which isn't bad when you think about most people go to fat farms and all kinds of stuff, and they pay thousands of dollars, and so it'll be much better. And you actually only have to take this part during the first 2 months, which is nice. So it actually, the last month, you know, the homeopathic's going to be around $40 for the last month. Okay, so metabolic syndrome. This will get rid of metabolic syndrome, which puts you at higher risk for stroke, heart disease, high blood pressure, and diabetes. Isn't that interesting? Same problems. Sleep apnea. It was really it's been fascinating to me my whole life, dealing with people with sleep apnea and obesity, hypoventilation syndrome. That's actually a new one that's come up in the last 5 years. Sleep apnea has been around for years and years and years, and they put people on these machines that would blow, you know, intermittently oxygen into them. And these people, literally what sleep apnea means is you stop breathing while you're sleeping. And the body gets such a low oxygen content that all of a sudden you'll be startled by your autonomic nervous system because of such low oxygen in your body, because if you get too low, you die. So the body startles you, makes you wake up and start breathing again, and it disturbs your sleep, and then you go to sleep again, and then your oxygen goes down because you stop breathing again, and it startles you. So these people just don't get good sleep. And so they put them on these CPAP machines, and they found that these people, even on the CPAP machines, would get fungal infections, lung infections, heart disease, all kinds of problems just from the CPAP. And so what I started doing was intuiting what actually was causing the sleep apnea was fungus in their bodies, because their sugar levels were too high for diabetes and obesity and all these things, and it was causing fungal infections. And the fungus would get into the nerves here in this area, and they like a low PO2. And so they would make the nervous system not work properly, so you would get sleep apnea. In other words, the fungus decreased the ventilation and would even stop your own ventilation while you were sleeping, causing sleep apnea. Because when I could get people to lose weight, get rid of the fungus, their sleep apnea would naturally go away. So, now the same thing with obesity, hypoventilation syndrome. Treatment is the same, because it's just a different name for the same thing. The people who have the hypoventilation syndrome, they're breathing too little. They don't totally stop breathing, but they're not getting enough oxygen during the night because their breathing slows down. But luckily it doesn't stop with like sleep apnea. Apnea means stop breathing. The hypoventilation means you slow your breathing down, but they're caused by the same stuff. Okay. Cost of obesity is as high as the cost of diabetes. You know, we have people going out there and getting their stomach stapled, you know, and the surgeons love it, and it's big money. And, you know, in products for obesity, you know, it's just so expensive, and the people who are obese can't work as good. They're not as efficient. Their brains are not as fast. And so they found in studies that all of these people have decreased productivity, and also increase in, you know, your hip replacements, your knee replacements. I'm going backwards here. Hip replacements, knee replacements, osteoarthritis, so they're on arthritic medications, and It's just billions and billions of dollars to be fat. So here in the United States, 33% of the population is fat. 1/3 of the people you see walking around are obese or morbidly obese. And so to get healthy, we need to help them lose weight. So does anybody have any questions? I'm going to go out of this just for a second, and I'm going to play a video that is quite cool that I found on obesity and cancer. This dude is talking about obesity and cancer, and I'm gonna play his thing, and hopefully we can hear it. Yeah, I don't know if you heard that, but it's slated to replace tobacco as the major cause of death, because tobacco is getting less and less. Can anybody hear it?
I don't think so. Obesity after a diagnosis of cancer is unfortunately associated with worsened outcomes.
I'll kind of recap it when it gets done.
ASCO has been very interested in helping to educate both patients and providers about the links between obesity and cancer.
They're talking about the links between obesity and cancer.
To help both patients and providers start to address overweight and obesity.
They're just barely teaching the doctors about this. Because they didn't teach us this when I was in medical school.
Resources, both for patients and providers, that talk about the connection between obesity and cancer and provide practical suggestions for beginning a weight management program.
ASCO is a natural organization to tackle the problem of obesity and overweight in the context of cancer. We are the practitioners who take care of patients with cancer, and it is.
This is a non-oncologist, by the way, somebody who takes care of people with cancer.
Recognizing that a patient is obese is an important part of oncology management, but we're not suggesting that oncologists become experts in helping patients to lose weight. ASCO is suggesting that oncologists assess a patient's weight during their visits, advise a patient if they notice that they are in the obese range, and then help refer a patient to services that can
This is a very short video,
help them lose weight.
so bear
This
with
may
me.
be through the primary care physician's office or other services in the community. Weight is a very delicate topic, and although this may be something that patients have on their mind that's concerning to them, they may feel uncomfortable bringing it up with their provider. Conversely, providers at times can feel that this is a sensitive topic, and in a patient who's gone through a lot in terms of their cancer therapy, they may also be reluctant to mention weight. This is one of the reasons that ASCO developed the toolkit, was really to find ways to help operationalize the communication about weight so that patients with the toolkit in hand can talk about their concerns about weight, and providers can have a neutral way of identifying concerns about a patient's weight and the potential impact it may have on their treatment or their outcomes. We are not suggesting that oncologists begin providing behavioral counseling for their patients to help them lose weight, but being able to identify obesity as an issue and providing materials can be an important first step in helping patients to start to manage.
There's the big weight. She doesn't really have,
lifestyle change after cancer diagnosis.
huge legs and stuff.
Trying to make sure that people know lifelong that this may be a modifiable risk factor. The best thing we can do is, of course, prevent the consequences of obesity by preventing obesity.
Okay, so this is the American Society of Clinical Oncologists, and they're the people who deal with cancer. They're recognizing that cancer is a huge risk factor. So, obesity is a huge risk factor for cancer. So, the bottom line is, we know what causes obesity. Obesity is caused by toxicity and overeating of sugars. That's what causes people to gain weight. And so we have to deal with sugars and toxins. Now, a lot of people with the fungus, because the sugars cause fungus in the body, and parasites, And so sometimes you have to start with the fungus and parasites. And a lot of people go, Dr. Murray, you're always putting people on parasite cleanse. You're always putting them on antifungals. Well, this is why. We have to deal with what's causing the problem. Because they get in our body and they stimulate us to overeat because they want to be fed. And they actually control our nervous system so we can't even make our own choices anymore. They make the choices for us. And so when you get rid of the parasites and the fungus, they become less active in your body and they have less control over your body and your mind. So, parasite cleansing, fungal cleansing is vital for weight loss, but also getting rid of toxins. So how we're going to deal with that is using this system from systemic formulas that helps the liver bring the toxins out, and the bind pulls them out of the body. And then using homeopathics to help mobilize the toxins also out of the cells, repair the cells, the liver, the pancreas, the spleen, all of the organs that are being damaged. And when we do the detox program, they focus on the digestion, the liver, the kidneys, all of our organs of elimination. When I first did this detox, I was taking a bunch of pills all the time, and I could feel it working, and it pulled the plastics out of my system, it pulled the heavy metals out of my system, it pulled the chemical toxins out of my system, and it helped revitalize my organs. Well, when I met with this lady in Fairfield, she was like, Scott, I can't do all those pills. So when I came up with the idea of doing the homeopathic, St. Germain came to me and added to that I should add this. So I was figuring on making a bottle for each 30 days, because most of the homeopathics, if you make 2 ounces, you take 10 drops a day, 3 times a day, and it will do the detoxification for you, but you have to work on first the extracellular matrix, then the intracellular matrix, and then work on revitalizing the organs and the cell membrane. And so the homeopathics can't do it all in one thing. It would be too much and the body would get confused and it just won't work. But if we do it methodically in a 90-day detox with the homeopathics, it'll work really good. Now, I met a lady there in Fairfield, and I'm bringing this up for the fact that when you get a lot of fungus and parasites in your system and bad bacteria, you can form what they call a biofilm. Now, this biofilm is actually a covering around in your intestines that doesn't allow you to absorb your nutrients. So you eat more food and you're not absorbing your proteins, your essential fats, but the sugar gets in. So you get obese and you're craving food because you can't get your nutrients. And so your body says eat more because you got to get those nutrients, and yet that biofilm is keeping you from absorbing the nutrients. So if you've got a biofilm problem, we have to treat that first. So that's parasites, fungus, and bad bacteria. So right now in the United States, there's over, what were they saying? 300,000 new cases of Lyme's disease diagnosed per year in the United States. And that's the one that the people come in, they get the blood test for the Lyme's, which is not as many. So we're having a huge epidemic. And while I was in Fairfield, this guy showed me this article that it's not only spread through ticks, but also spiders. So spider bites can transmit Lyme's disease. A cockroach bit this lady, and I got that they gave her Lyme's disease, and I was like, what the heck, And so the Lyme's is getting in all these different insects, even fly bites, like horse flies that bite you. They can give you Lyme's disease now. So we're having this huge epidemic of Lyme's disease, and in Lyme's disease people gain weight also, and they get this biofilm because it's a combination of parasites, fungus, and bacteria. So we have to treat the biofilm also, and that's why I'm bringing that up. So anyway, does anybody have any questions about obesity? It's almost 1. Anybody have any questions?
So breaking down that biofilm, how does this?
Okay, the biofilm, I haven't even discussed it in here because it's a totally different subject. So, we should ask the question, do I have biofilm? And if you do, and you may have a little bit because it's reducing your ability to bring in nutrients. So we maybe ought to do a biofilm protocol.
Just finished parasite fighting.
Yeah, which treats the fungal and the bacterial component. It doesn't treat the bacteria. The fungal and the parasitic component doesn't treat the bacterial component. So in some people, we may need to do a biofilm protocol for a little while and get rid of that. What I've had happen in people with biofilm, literally when it comes off, you'll see this white filmy, plasticky-like stuff come out in the stool, and it strips it off the whole intestines because it's surrounded the whole interior part of the intestine. And so when you get it out, it comes out in this mass of filmy, fibery stuff. It's quite fascinating. Okay, so if nobody has any more questions,
One question.
Go ahead.
Menopause. Women tend to gain weight around the midsection.
yes.
Is that
Now, women are going through menopause earlier and earlier. Infertility is on the rise. And guess what it's from? Fungus, parasites, and toxins. So if there's and there's worsening of the side effects of menopause, hot flushing, and just arthritis. All these problems increase when women go through menopause, and it's actually a sign that we got to get the toxins out of the body. Because when you've got toxins in your body, it suppresses your immune system, so you get all the critters in there. So it's all interrelated. Thank you for coming today, and any other questions? Okay, very good. I'll turn this off and hopefully get it on the